Hi, my name's Dr. Ross Hauser. Welcome to the Hauser Neck Center here in Fort Myers, Florida. I'm here with just a wonderful lady, very good positive energy. And I wanted you, Patti, just to share your story because there's lots of questions that people don't know the answer to. For instance, patients, as you know, a lot of patients fly in here, and you're from Utah, so you also fly into Fort Myers to see me. And we've only seen each other, like the initial visit, your first visit and second visit. So this would only be my fourth time seeing you. But you have an interesting thing in regard to your symptoms in that, you know, when you live at altitude, the symptoms are really bad. And then of course, when you get down to sea level, right? Like my property line is at 6 feet above sea level. Because why? Because I live across the street from the water. You know, like I'm, you know, I'm so. As you know, when you get in altitude, that raises your intracranial pressure. So if somebody already has high brain pressure, they're going to feel worse at altitude, like in Denver, or you know, you can explain where you live, and then obviously when they come to sea level, the brain pressure goes down and they feel better. But why don't you just tell us your story and then why you ended up coming to Caring Medical here in Florida?
So we were living in Idaho. I was in a T-bone car accident in 2019, and it didn't seem that bad at the time, but over time, my eye pressure got worse, my brain pressure got worse. I just lost the ability to live daily normally, and nobody knew what to do with me. Saw tons of doctors, and then we relocated actually just last year to Utah, and found a wonderful doctor who was helping me figure out the eye pressure piece especially, and brain pressure, and so that's how I got here. And interestingly, I noticed after my first trip, I didn't put it all together, but I got into Florida and felt significantly better. I had energy I didn't even know what to do with for the first time in years, and I just felt happy. I mean, it was very, very strange to feel that way after all that time. And so I thought it had to be maybe I was just excited to see you, to get help finally for the first time. And but then the second time we came and I came in, I couldn't sleep for the first 2 nights. I had so much energy.
Wow.
I had so much less pressure in everything. And that's when I mentioned it to you, because I couldn't figure out what am I going to do in my day-to-day life in Utah. And we're not too high. I think we're about 2,000, but still it's different. And when I come here, it is just relief.
Yeah, why don't you explain all the symptoms prior to you coming here? Why don't you just, I know you got a lot of symptoms, but why don't you just, for everybody, like what exactly were all the symptoms?
So I became pretty much bed and couch ridden because I had vertigo, nausea. The eye pain was really one of the driving forces. I couldn't. I had light sensitivity. I had to wear sunglasses inside. I could barely go outside.
Well, right now there's really bright lights, right?
And I'm able to manage
so that's even that's a sign that you're getting a lot better.
Yes.
Okay, and then what other symptoms?
And then just pressure in my brain. Terrible pains in my neck, and that all just kept getting worse and worse and worse as time went on. And so I just was not able to, I couldn't go to a grocery store, I couldn't drive, I couldn't take care of myself, I couldn't cook, exercise. I was very healthy before the accident and in great shape, and I could not do anything. Even just walking, I used to try to walk just down the street. I couldn't even do that, and I had to have my family help me.
Wow.
To now, I can walk a couple miles.
Awesome.
Not as regularly as I want yet, but I'm getting there. Can't lift weights yet, but I'm getting there.
Well, here, let's just talk for a second. So you had all these symptoms, and they were worse at altitude.
Yes.
So even before your first prolotherapy session,
yes,
you just coming to Florida, which is at ground level. So now people know a test for intracranial hypertension. Like if you feel terrible in the mountains but feel better at sea level, you know, like you have all these symptoms that you described, then most likely that the person's suffering from intracranial hypertension. Now, when you're in St. George, you know, like where you live, how much are the symptoms better? Like, do you feel like they're 25% better or
Since
50?
starting prolotherapy, I would say more like 30 to 40% better so
great
far.
after 2. Yeah.
And just prior, just to kind of backtrack a little bit, just when we'd moved, when I started noticing the elevation piece of this, my son got married in, I think, Alta Lodge or something out in Salt Lake City, which was about 8,000 feet.
Yeah.
And I could not participate in my son's wedding.
Okay. Wow.
I was so sick. And that's when I started kind of connecting dots.
Okay. Yeah. No, I've often thought, because you always wonder, this is just a side story, but I often wondered, you know how like there'll be people hiking in the mountains, or even, you know, I'm an endurance athlete, you know, and my history is I've done 5 Ironmans and, you know, cycled in the mountains and all this stuff. And it's always interested me, like, this person in the mountains gets sick and this person doesn't. You know what I mean? Like, you know, climbers or hikers or in expeditions, and no one ever has a good explanation of why did that person get sick and somebody else didn't. Well, now people know one of the clues. So if you're a hiker or you're somebody who likes to be in the mountains but you get sick in the mountains, then it's likely you have intracranial hypertension, which I believe usually that's from a change in the neck curve blocking the jugular vein. So an easy thing for anyone watching this who this might apply to is just get a lateral cervical x-ray, and if it shows a reversal of the curve, obviously a real easy thing to do would be to put your computer screen high and stop looking down at the cell phone. So I'm probably too, we taught you a few of those things, right?
Definitely.
So you're,
yep.
You've been compliant?
Oh yeah.
And then we also told you to sleep in a certain way, right?
Yeah, I really have been working on just being flat on my back.
Okay.
And that helps. It really has helped a lot.
Yeah, because we found that when you're flat on your back and you're not flexed, your jugular veins open. So then, of course, that's going to lower your brain pressure too.
Yeah. And I take those I do the 5-minute breaks throughout the day too, to lay flat.
Okay. So yeah, another easy thing for people to do, if you think like you have intracranial hypertension, just lay down, because the jugular veins are more open when you're laying down than upright, and sometimes that will significantly reduce head pressure and all the other symptoms that might be due to head pressure. You know, so prolotherapy is not for the faint of heart. So what would you say? I mean, it is a painful procedure. So what would you say about that?
I say it's worth every bit of pain. I was telling my husband prior to this trip, it sounds really strange, but I can't wait to get shot.
Okay, wow. Wow.
It's made that big of a difference in my life that
okay, great.
I don't even worry about it anymore.
Great. So why don't we, maybe later on we'll interview you later just to see how the treatment's progressed. And obviously our goal is to get you where you don't need doctors, right? Because that's the goal of every doctor, should be that they help you get so well that you don't need doctors. Like, I don't even like doctors. Like, I don't even look at myself in the mirror. That was a joke. No, thank you so much for sharing your story.
Absolutely. Thank you for what you do and for changing my life.
Thank you so much.
Yeah.